Hello, and thank you for joining me today. So today I'm going to talk about nutritional therapy to increase the success of fertility treatments. Why am I talking about that? Well, I've had a couple of conversations this week with consultants who don't normally work with dietitians and nutritional therapists, and with clients who are considering fertility treatment. And what they are wondering is, what can nutritional therapy have to offer to improve the success rate of fertility treatments? So that's why I'm going to be talking about that today. So the first thing I'd probably like to do, I am going to do, is to have a quick cover of what fertility treatments are out there. So there's 5 main treatments. The first one is IVF, in vitro fertilization. That's probably the most best known of the assisted reproductive technologies. In IVF, the sperm and egg are collected, and they're placed together in a petri dish in the laboratory, and your embryologist will observe the fertilization, and after a few stages of the development of the embryo, they'll select the good quality embryos and insert them into the woman's uterus. This is after sort of 2 to 5 days after they have been placed in the dish for developing. The next one is intrauterine insemination. Now, this is probably the simplest of the assisted reproductive technologies, and it involves collecting sperm and preparing the sperm in a lab and then putting it into the womb close to the time when the woman is ovulating. So it's probably the most normal or natural of those processes. Another one is the intracytoplasmic sperm injection. Now, this is when there is a problem with the sperm or the male factor. What they do is they select a single sperm, remove the tail, and then inject it into the eggs. It's quite invasive and is only used when it's absolutely necessary. The fourth one is in vitro maturation. And what they do here is that they collect immature eggs from a woman's ovaries during a natural, unstimulated cycle, so without the treatment or without hormone treatment. They allow the eggs to mature in the laboratory until they have reached a sufficient level of maturity. The treated sperm are then injected into the eggs to fertilize the egg, and then the embryos are then placed in the mother. And the final one is vitrification, which is a sort of fast freezing method. They can freeze eggs, they can freeze sperm, they can freeze embryos. Previously, the old method of freezing eggs caused problems because of the sort of uncertain process of when they are being thawed, and so it leaves ice crystals in the eggs or the sperm. The new process, the fast freezing process, doesn't have that problem and has a greater success, so there's no ice crystals there. So 5 common methods that are using. So the question then becomes, when is the best time to consider nutritional therapy to have a successful fertility process? Well, the best time is a few months before you actually start the fertility treatments. And that allows you to correct nutritional deficiencies, remove harmful substances, achieve a healthy body weight, and a lot of other processes that will help to prepare the body and to ensure that there's good quality sperm, good quality of eggs, and that the woman's body is prepared and at its optimum or best condition to support a healthy pregnancy. Some people might wait until they have achieved a successful pregnancy, because then we know that the process, or I'm told, and women express that the process of going for fertility treatment can be quite stressful, and it seems and can be not the first thing that they think about when they're trying to get pregnant. So often women will come to me at the time of conception, when they're in the first few weeks of pregnancy. At that time, we can do a lot. We can help to adjust the hormone levels, make sure that the pregnancy progresses in a healthy way and the baby develops as best it can. But most dietitians, most nutritional therapists would say, well, the best outcome, the optimal outcome, is to start before you start the fertility treatment. So what do we do? Well, one of the things that we would do is look at cleaning up the diet. Now, what I mean by cleaning up the diet, it's by systematically eliminating or reducing harmful substances that can interfere with fertility. For example, we would look at removing endocrine disruptors, reducing the load of phytoestrogens. These are naturally occurring compounds in foods that can produce excess levels of estrogens, which can interfere with your fertility. We'll look at reducing the amount of pesticides that's in the diet, and also obviously alcohol and caffeine. The other thing that we would also look at this time is those food safety rules that we would normally apply once you're pregnant. We'd apply that to this stage, so at the time when you are around about the time the eggs are being planted back in, because some of those harmful bacteria that can occur in foods can produce early stage miscarriages. So in the early stages, we would also look at applying or going through covering those food safety rules to avoid things like listeria, salmonella, and campylobacter. The other thing that we do is correct nutritional deficiencies by helping people to have a healthy, balanced diet. It's a little bit more than the healthy, balanced diet that we would recommend for the general population, because what we need to do is to make sure the diet is rich in those nutrients that support a healthy sperm and a healthy egg, and support the body being able to carry a successful pregnancy to term. So the nutrients that we would look at are, for example, are the minerals like iron, zinc, iodine, and selenium. We would also look at making sure you have the right balance of those omega-3 and omega-6 essential fatty acids for healthy brain development and healthy development in those first few weeks. We would look at the quality of the proteins for vegetarians as well as for vegans and non-vegetarians. And those all important B vitamins like B6 and B12 and the folates are also important. So we would go through the diet and make sure that the diet has sufficient amounts of those. And to build up a level in the body, it takes a couple of months to have that environment where that the eggs and the sperm are at their best. There is a little known fact that B vitamin deficiency in father's diet can produce sperm that look normal and healthy, but they carry an increased risk of miscarriages. So it's quite important to look at the diet of both the mother and the father when we're considering improving the success of fertility treatments and ensuring that the pregnancy goes to term. Another thing that we would look at as part of this correcting nutritional deficiencies and ensuring a balance is moving from high glycemic index foods. So these are the kind of carbs that bounce your blood sugar levels around and put your metabolism out of whack. And we would replace those with the low glycemic index foods. So these are the healthy carbs that help to regulate your metabolism. So because some hormones require carbohydrates to be formed. So going on to a low carb diet or removing the carbs from your diet altogether will actually harm your fertility. So it's important to have a balance and to make sure that you've got those good quality, healthy, low glycemic index carbohydrates in your diet. Another area that we would look at is making sure that you have a healthy weight. Now, for quite a few clients, once you look at reducing harmful substances and taking out those other compounds, that would adjust the diet into a healthy way and regulate the metabolism. And when you correct nutritional deficiencies, that also helps, and switching from the high glycemic index foods to the low glycemic index foods. And for some people, that's sufficient for their weight to adjust either upwards or downwards to produce a healthy body weight. Some clients may need additional support to gain or lose weight in a way that doesn't compromise their fertility, that doesn't cut out those essential important nutrients. We know that achieving a healthy body weight before starting fertility can significantly improve its success. We need a certain amount of body fat to support a healthy hormone levels to produce good quality sperm and eggs. And for mothers, it helps to support a healthy pregnancy and healthy development during pregnancy. However, too much body fat increases the amount of inflammatory chemicals in the body, and it can also cause insulin resistance, which interferes with your hormones, and it can also produce excess estrogen levels. These changes reduce your fertility and increase the risk of something going wrong during a pregnancy. So, to summarize, the process of cleaning up your diet, removing harmful substances, of correcting nutritional deficiencies, of achieving a healthy body weight will help to improve your fertility success rate. So to do that can take about 2 to 3 months. So most dietitians and nutritional therapists in this area would say that you should start a nutritional program about 3 months before you actually start the fertility treatment. So I've only covered 3 of the strategies to improve your fertility treatment success rates. And we've come to the end of our session today. So if you'd like to learn more about nutrition and a successful pregnancy, just give me a call or use the link to book a free health discovery consultation session with me. I'm Eulalie Green, and thanks for listening, and I look forward to our next session.